Not all progesterone works the same. How you take it changes what it does in your body. I'm Dr. Brar, board certified family medicine physician and certified menopause provider. Progesterone has the reputation that it's really just meant to protect your uterus when you're taking estrogen, but it does so much more. Progesterone has effective vasomotor symptom relief at higher doses, improved sleep quality and architecture, mood stabilization without causing depression, and micronized progesterone has cardiovascular safety that is superior than to the synthetic progestins. There's also enhanced bone formation when it's combined with estrogen and neutral metabolic effects on weight, glucose, and lipids. So let's start with oral progesterone, which is called micronized progesterone. Oral is really the only form that's really converted in the liver into metabolites that act on the GABA receptors. That's why it can improve your sleep, reduce your anxiety, and have a calming effect. We usually use this when patients have insomnia, anxiety, and perimenopausal symptoms. This is really your go-to for systemic symptoms. Next, we have transdermal progesterone. Topical progesterone creams are popular, but they have unpredictable absorption. They may help with mild symptoms, but they do not reliably protect the uterine lining if you're taking estrogen also. So we don't rely on them for hormone therapy. Then we have vaginal progesterone. Vaginal progesterone delivers directly to the uterus with less systemic effect. We use this when we want targeted uterine protection, or maybe in patients who can't tolerate oral progesterone. There's also the progesterone IUD, which is levonorgestrel. This works locally in the uterus, and it's great for endometrial protection with estrogen therapy. It's also good for heavy bleeding, long-term convenience, but it has minimal systemic effects, so no sleep or anxiety benefit. You can have an IUD and also take oral micronized progesterone to have the benefits for sleep and mood. So if your goal is better sleep or less anxiety, oral progesterone is usually the best choice. If your goal is that you just need uterine protection, we often choose vaginal or an IUD. So talk to your provider about your symptoms and about progesterone and in what form you may benefit the most from it. And there's a lot of nuance in how you take it, whether you take immediate release or sustained release, and also what dosing you might require. There's also nuance in if you take it every day or you take it cyclical. So there's a lot to speak with your provider about to come up with your individualized plan. Thank you.